Hey guys, it's Dr. Jake Geezy. I'm a doctor of physical therapy and certified personal trainer. And I love the hike and I love the backpack. And that's what I do. I help other backpackers and hikers stay pain free and on the trail, and then help them with their strengthening needs so that they can get onto their next adventure. So let's talk about something that I see a lot online and hear a lot about with other backpackers and hikers is, can you backpack with a herniated or bulging disc? So, if you don't know, like I said, who I am, I'm a physical therapist, doctor of physical therapy, and I love helping people with back pain. And then I also help people that are backpackers and hikers. So, this is a great question for me, and I'm super passionate about this topic. So, the topic of should you backpack or hike with a herniated disc, if you just think about that, right? I say herniated or bulging disc, most people think negative. They think, oh, they think a lot of pain. They think I need to be in bed, can't move, right? Those are all the things that come to your head when you think of a bulging or herniated disc. But what you find is that, with anything that's structural, something that you find on an X-ray, MRI, that sort of thing, it doesn't always mean that you're going to be having pain, right? So, for example, you could have a hypothetical 20-year-old male, right? And they have a herniated disc in their back. So it's not bulging, it's herniated. It's actually pushing a little bit against the nerves. But they don't have any pain, right? And it's not just because they're young. You could see this in older people too. You could have a herniated or bulging disc and they don't feel any pain. You could have the complete opposite. You could have somebody that has a heck of a lot of pain, but you get an X-ray or MRI and you find nothing, right? There's really no findings. Maybe there's a little arthritis or something like that. And this is super common. We see this all the time as a physical therapist. People that have had back pain, and maybe it's not coming from the back. Maybe it's coming from your hip. Maybe it's coming from your upper back, that sort of thing. Pain is very different for different people, and you can't always just based on your X-ray or MRI on whether you should have pain and what you should be doing. Okay. More so, the question is how are you feeling? Right. So if you have you have a bulging disc or a herniated disc, typically the first couple weeks are going to be super painful. You might really struggle to move. You might struggle to get out of bed. And if you're one of those people, go ahead, comment below and tell me your experience, right? But typically, the first couple weeks are super painful, but then after that, you start feeling better. It gets better. And this is because your body knows how to heal itself. Your body's inflammatory processes that you have, it heals itself through this process. So even if you have a herniated disc, oftentimes you don't need to get a surgery because the body will kind of engulf that up and heal itself. And this is why you even seen research studies showing people that have had a herniated disc in the past now doing, say, like deadlifting exercises, like lifting a lot of weight, strengthening their back. Now they have bigger discs and they have no herniated disc, and their X-ray looks great afterward. So your pain is not always associated with what you find in an X-ray or MRI, and typically it's more about the time frame. So I wouldn't educate somebody to go on a backpacking trip, maybe if it's very acute and they have 7 out of 10 or higher pain all the time, they can't get up and move, then yeah, sure, you wouldn't want to go backpacking. But if you have had that for a while, maybe 3 weeks or more, then maybe you can consider it. But it really depends on you and what your goals are, how long you're going, how hard the hike is going to be, your experience level, all these certain things, right? And so this going more into this, you really need to talk to your doctor, your physician. You need to talk to a physical therapist like myself or someone else, and just talk about this whole process and whether or not this would be a good thing for you. And more so, not can you do it, but you could almost say, maybe you can do it, but we just need to modify some things, right? So those are the things that I really want to hammer home here, is that the imaging doesn't necessarily matter so much. Your body does heal itself, which is super important to know, and that we can get stronger and we can get back to hiking and backpacking again. So don't let that scare you. If you have had back pain, or if you want to know more about back pain or back pain with hiking, that sort of thing, go ahead, comment below and tell me your story. Or if you want to know more about something else, like the video if you found it helpful, and go ahead and subscribe. It really helps me out. I would really appreciate it, and I hope to see you on the next one. Take care, you guys.